All right. So this lecture supplements the others on teaching and learning theory and effective patient education, and we'll talk specifically about some of the mechanics and the best practices that are needed for designing educational experiences. And you can put this into, in terms of practice, you're going to put this into practice by designing an educational activity and experience that you'll give to your peers, and you'll also design educational experiences that you'll give to your clients or your patients in the clinic. So this slide was ended the presentation that we talked when we talked about the introduction to learning theories. So some general and instructional planning guidelines that you should think about when providing education to others. And I've kind of found it in three areas. So what is the goal? So the overall purpose for the teaching session. Are you trying to correct a problem, or are you trying to create something? So depending on what your goal is, you'll break it down. You may break it down very differently. So with underneath the goal are, what are your objectives? So what are the steps or activities that are measurable ways of reaching that goal? So how can you break it down? How can you go from simple to complex? Or, we talked in one of the other lectures about teaching the whole, then the part, and then the whole. So what, it's going to be the best way for you to provide those activities into very easy, measurable steps that will help your patient or your client be successful. So maybe that will be starting with following directions, listing the ingredients, combining ingredients. So very specific measures or objectives that will help you be successful. And then finally, what is the person's readiness? So where's the learner at? So part of this that I want you to start thinking about too is that trans-theoretical health model. So where's the person at? Where's your learner at in terms of their readiness to learning? Do they even have are they in the pre-contemplation phase where they're not even thinking about making a change, or are they already started? Are they in the action phase where they've started to make that change, and your activities may be very different in terms of maintenance and continuing success? But all of these components going forward, I want you to think about in terms of they're all going to be components that you're going to be working on and expanding on when you're outlined for your teaching project. So planning a teaching assessment is the first thing that you should think about. So when you're planning, you're assessing the characteristics and the needs of the learner and the learner environment. So who are your learners? Who are you teaching? Are they patients? Are they families? Are they coworkers? Are they classmates? What do they need to learn? What is the design framework that you're gonna use? What is their experience or their familiarity with the topic? Do they already know a little bit? Do they know absolutely nothing? What are the physical requirements? What are the space, the equipment that's needed, the time that it's going to take? So thinking about the entire picture, what the time it's going to take, and then what resources do you need? Do you need handouts? Do you need media? Do you need what in the environment do you need to help this be successful? So specifically your audience, right? So who are the learners? Again, are they your patients, your families, coworkers, classmates, the community? What are the things that you need to think about when, with you in terms of your learner? So what is their motivation, right? What is their interest? What is their age? What is their culture? What is their level of education? How specific or detailed can you be with your educational activities? What language do you need to use? What is their learning style? So how do you need to design your activity to fit your learner's learning style? Do you have Can you use, are you familiar, or is your learner familiar with technology? Will any of those instructional tools help you? You want to know, what do they want to learn about? What are you going to teach? So you might need to investigate the topic, design the framework, and take the learners into consideration when you're designing what's going on. Oh, so again, what do they know about the topic? What's their experience or familiarity? Allow for processing times. Is it going to take them longer to learn about different areas or different objectives within your topic? Where will the education session take place? And again, is the person ready to learn, or where they are in that continuum of the trans theoretical model? So what you need to think about, what we want you to do when you're developing a learning topic. One of the big areas are, what specifically do you want the person learn, and how will you measure it? And that comes with formulating learning objectives. So what do you want to formulate learning objectives in terms of terminal behaviors of the learner? This is very much like writing short-term goals. You're going to write very specific terminal behaviors that you want the learner to be able to demonstrate. And within that, consider there are different domains of learning that can apply to all of the activities. So Bloom's model, you may have learned or heard of Bloom's taxonomy of learning before, and Bloom talks about three domains of learning, where people learn in the cognitive domain. So it's that it's that thinking, very academic knowledge base, academic knowledge or thought processes that occur with learning. There's the psychomotor domain of learning, where people learn more by doing. So it's that purposeful movement, those activities that a person may be learning about or using to learn about. And then the affective domain. So it's those feelings, the willingness to learn, that includes all the different senses that help support learning or learning in that way. So people learn three different ways: cognitive domain of learning, the psychomotor domain of learning, and the affective domain of learning. And Bloom gives some very specific skill levels within each domain. And if you look at these skill levels in each domain of learning, they're really founded on that cognitive learning theory that we talked about in another lecture, right? That talks about you learn, one method of learning is from the simple to complex. So Bloom's domains of learning and Bloom's taxonomy talks about how to teach and how you might build on skills from the simple to complex. So depending on where your learner is and what you want them to learn, you may use different taxonomies or different ways to describe learning based on if you're teaching a simple skill or a more abstract or complex skill. So this is Bloom's cognitive domain of learning, where within the cognitive domain, you teach knowledge, comprehension, application of that knowledge, right? Analysis of the knowledge, synthesis of the knowledge, and then evaluation of the knowledge. So you can see on the left-hand side of that grid are much more simple, concrete skills, and on the right side of that grid are more abstract and complex skills. So depending on where your learner is and what your goals are, your objective may be for the person to cite knowledge, right? On the left-hand side, your patient you want them to cite three activities that are important in this skill or something. So it's a very memorization defined listing type activities, versus all the way to the right, where you're having a person really evaluate the knowledge that they've learned. Can they appraise their knowledge? Can they assess their knowledge? Can the person measure the amount of success or rate the knowledge and the application of that knowledge? You can see there's lots of lists in between there, but there is, now you go from left to right, where you go from simple to more complex. So Bloom, if you look at some of the newer terminology that Bloom uses, this is just to show you that there are lots of ways to describe cognitive knowledge, and whereas Bloom used to talk about knowledge and comprehension, the new terms are remembering and understanding. So if you look to the right this right-hand column here, Bloom now will use recognizing, under remembering, they recognize, they list, they describe. To understand is to interpret, to exemplify, to summarize. Then you still see apply, analyze, evaluate, and create, where by the last if you're looking at the grid technology, the last grid or that last level of knowledge, the creating here, where the person's designing new knowledge and creating knowledge and producing knowledge and viewing things differently again. So that in this list, the top terms are the more simple and concrete terms and taxonomies, and at the bottom are your more complex and more abstract. So Bloom also talks about 7 levels in the psychomotor domain, again to the left being the more simple and on the right being more complex, where initially you may just, again, these are psychomotor, these are the active doing activities, where on the left, that you're asking the person to hear, to see, to smell, to touch, they're doing something, and all the way to the right, they're using that knowledge to create, to construct, to design, to produce different activities. So the affective domain is probably one of the hardest to be able to describe and to operationalize, but Bloom describes 5 different levels of the affective domain. So again, these tend to be a little harder to measure, but on the left, again, the more simple ways to describe and to objectify the affective domain is the person receiving information. So they accept, they attend, they develop, they realize, right? The person realizes, your patient, a goal may be that they will realize the importance of making this behavior change. And then as you move to the right on that grid, the activities become, again, more complicated, more abstract, where all the way to the right you have the most complex activities within the affective domain, and certainly the hardest to measure, I would say, would be to say that to measure that the person has truly internalized the benefits of this behavior change, or they've verified. So these are really, really difficult to be able to do, but being aware that in many cases all 3 domains of learning are often the most, using all 3 domains of learning are usually the most effective to help a person learn. So they need to cognitively be able to understand what the goal is and the activity is. They need to be able to physically carry out the goal. And here, the affective domain, they have to be able to accept and be motivated to make that change and understand that it is important, and to cooperate and to discuss and to defend the activities. You need to value it. So within learning objectives, and we're going to do these in class, but I want you to think about when you write learning objectives, and you should really think about being very systematic in your teaching. So what specifically do you want your patient to learn? And again, this is very similar to writing goals, right? So when you write goals, they need to be very, very specific. They need to be measurable. They need to be timely. Very similar to writing learning objectives. So within each learning objective, it should be written to address one outcome, right? When you write a goal, you want to address one outcome so you know if you were able to meet them or not. So each learning objective should be written to address one outcome. They should identify the conditions under which the learner will be able to demonstrate the intent of the outcome, or the objective, sorry. They should be measurable, and they should be able to be evaluated at the completion of that teaching segment. So you should be able to know at the end, did I meet the goals or not? And so think about how to write good learning objectives, and we'll practice them in class. So good learning objectives communicate the intended instructional outcome. So specifically, what did you want your learner to learn? Who will do what and how much by when, right? So the learner will learn something to what degree, right? To how measurable do they need to be 100%? Learn at 100% to be 100% accurate, or is 75% accurate enough within your goal? And then by when? So should they learn it by the end of your instructional program, or in the next week they will be able to do something? So who will do what, how much, and by when? And then we'll give examples in class. But I want you to think about it. If you were having a person perform a home exercise program, what would be a specific objective? Right? So maybe initially, if you go back to some of that cognitive theory, it's the patient will be able to list the exercises that you provided them with 100% accuracy within 24 hours, right? Or if it's a psychomotor goal, the patient will be able to perform a straight leg raise 100% correctly by the end of your exercise program. Right? Or if it's an affective goal, maybe it's the patient will understand the importance of performing these exercises to prevent further injury by the next treatment session. So you've got to be specific that will do what, how much, and when. So just some examples. If you think about, we always talk about exercises, but if you think about things like cooking, really good examples for writing learning objectives. So if we're talking about making lasagna, by the end of the lecture, the participants will be able to list the ingredients for making plain lasagna. So by the end of the lecture is timely. You want them to list the ingredients, so you're very specific on what they should be able to do, and you want them to list all of the ingredients, so that makes it measurable. And that would be a good example of a cognitive domain learning objective. A psychomotor domain learning objective regarding making lasagna would be by the end of the lecture, your participants will be able to combine the ingredients in the correct layers. And an affective goal for making lasagna may be, by the end of the lecture, your participants will be able to savor the flavor of a well-made lasagna. So other things to think about in terms of designing a teaching segment, you want to think about what you're going to, or how you're going to design the activity. So if it's a psychomotor goal versus if it's a cognitive goal versus if it's an objective goal, the experience may look a little bit differently, but your experiences need to be consistent with, and your activities need to be consistent with your objectives, the learners, the learning environment, the resource characteristics. What do you have to use that will help you with this? And then any restraints. So anything that might be a problem or a barrier that might make it more difficult to teach within these sections. So you're thinking about all of these things. Remember, there are different types of learners from the learning style inventory. So if your learners are more concrete learners versus more abstract learners, that may change the way you provide your activities. Or maybe you realize that you have lots of different types of learners in your audience, so you want to teach things in different manners to give them different ways of looking at things, so you reach the concrete learners and the abstract learners. Think about active versus passive learning. So they is it is this an activity that will benefit from that experiential learning theory? Remember, that's an active learning theory, and you want a person to be able to actually try things and be active and reflect on that. That may help them be more successful. Again, on chapter 15, on page 271, there are presentation tips for educational activities. And 272, there's a checklist for educational activities. So there's lots of things to think about and resources that I want you to look for, and we'll talk about more in class. So again, just to think about this, right? You have lots of different level types of learners. So can you work in all of these areas to help the person that's more feeling, more comfortable with watching, thinking versus doing within your activities? So when you're designing your activity, you also want to think about the method of delivery. So how are you going to deliver this material? Is it going to be face to face? Is it going to be online? Are you going to be creating a video? And what will be most effective using that method? Will it be straight lecture, where it's a more cognitive learning theory, maybe that you're giving them some simple to complex specific cognitive things to think about? Is it interactive, where you can use that experiential learning models and learning theory? Will they demonstrate and participate? So will you use some of those the social cognitive or social learning theories, the constructivist theories that talk about communities of learning and participating in learning, and how does that environment affect the presentation? So you want to think about specifically about the method when you're designing your program. I want you to think about the technology that's needed. So within your learning program, what technology will help you be most effective? Is it technology in terms of video versus PowerPoint versus, maybe you're using apps and you're having their person using different apps and technology on their handheld devices that they have in class or within the setting? What props do you need? What specialized equipment do you need? And do you need handouts? Do you need something to look at? What will make it be most effective? And within that, what materials will be most effective within that? If you're using PowerPoint, is your presentation effective? Are you giving them just enough so they can read, or is it too busy? Can they see it appropriately from where they're sitting in the room? Same thing with handouts. Can the person read it correctly? Is it written at the level that the person can understand? Is it written in a language that they can understand? All things to think about to make your presentation be successful and be most appropriate. Then you want to think about, how do you assess whether learning has taken place? So you need to think about how you will assess your objectives. So if you write good objectives, can you assess them? So is there a test, written, oral, a practical exam that will assess the level of the learning? And this will be depending on what your objectives are, but you should be able, we want you to think about how you will assess that. And when you're writing objectives, you're writing your teaching plan, we want you to be able to give me very specific method of how you're going to assess. And you need to assess, what you should assess will depend on your objectives, but you want to think about assessing the learner. Did the learner learn? Assessing the learning environment and assessing you as an educator. Were you successful, or were you not in transmitting this material? So in designing that assessment tool, review your objectives, ask questions to determine if the objective has been met or not. You also, when you're assessing your learning activity, ask for suggestions to improve the presentations, and ask questions about the instruction. Were the instructional materials effective? Was the instructor prepared to deliver the activities? Was the instructor effective in transmitting that material given the environment and the materials they chose to use and the material that was instructed? Because depending on if the information is more simple or more complex, some people are more effective, and certainly understanding where the learner was or the learner is can help you with understanding whether the instruction and the instructor was effective. So just an example of a tool that you can use to evaluate an objective. So one way to do that is just using a very simple Likert scale. So rate your comfort level with the skill or knowledge. At the end of the exercise or the end of the education, I am confident that I understand the difference between this and that, or I understand why this is important, or I am comfortable, or I feel 100% competent in be able to perform this skill. And then you can use a simple Likert scale between 0 being no skill or not familiar, and 3 being very skillful or knowledgeable. And there's different ways to do Likert scales. Another example of evaluating a learning objective would be just to ask, do you have any recommendations for changes that would improve this presentation? I think it's always important when you're evaluating to give the learner the ability to write comments or suggestions. Again, another just a method to describe or an example of how you can evaluate a learning objectives. So some other tips for being effective and for developing effective educational programming, and these are again all listed in your book. But recommendations include kind of present the most important content first, because they'll remember that. Often they're usually more motivated to learn at the beginning. Be brief, emphasize the main point. Organize as well as possible, into different topics or categories that make sense for the information. Give specific instructions, especially if you're talking about a psychomotor activity, specifically how to perform. Repeat important information in a variety of ways, right? You already looked at, are you an auditory learner versus a visual learner versus a kinesthetic learner? So maybe if you can have the person read the material and hear the material and then be able to actually, try out and practice with the material using all different methods will, in a variety of ways, will help a person learn. Use the variety of cues. Again, the auditory, visual, and kinesthetic prompts are all helpful. And then present at the comprehension of the learner. So we're going to do this in class, but you want to think about the level of your learners. And usually for general, if you're thinking just general health information, it's recommended that you provide that information at the level of a 6th grade learning level or under. So you want to use very simple terms that everybody can understand, and that you doing that, whether you're delivering that verbally or whether you're giving it in written form, you want to think about the level of your learner and present in the most simple manner so the person can comprehend. You want to think of a person's culture, language, and literacy. So failure to recognize language or cultural influences often leads to undesirable health outcomes. So know where they're coming from and what their understanding is, and how they value different materials is important. And be insensitive to verbal and nonverbal language. So do you need interpreters if they speak another language? Do you need be sensitive to this if you're using technology? Can they read in how you're presenting, or can they take advantage of the technology that you're using? So some other things to think about. First of all, think about feedback. How do you provide feedback? Are you providing it ongoing, or do you provide it only at the end? Do you provide feedback constantly, or do you provide feedback intermittently? And this is important for learning in general, but you'll also get into a lot more when you talk about feedback, when you talk about motor learning, when you get into movement science. You'll talk a lot about feedback and when and why and how and what is most effective in different ways. But as a person's learning, what works for you? Do you want to be given feedback, at every step of the way, or do you want to try it out and give feedback at the end? And there are some different theories regarding what's most effective. You also want to think about reflection. And certainly that reflection, when to give it, is important. Some other things to think about in terms of feedback. Internal feedback versus external feedback. Verbal feedback versus nonverbal feedback. And do your messages match when you're giving feedback, when you're telling them something versus your nonverbal expressions, and is that most effective? You also think about feedback in terms of, again, I think talked about before, timing, immediate versus delayed, quantity of feedback, too much, too little, what works best to facilitate that skill performance, and that may depend on, again, the level of your learner. Are they a novice or are they more of an expert? And then the quality of feedback, very specific, very general. Sometimes it's more useful to do different types of feedback. Reflection, we've talked about in another lecture, but think about reflection for your patients or your activities as you're teaching. Reflection for action, reflection in action, or reflection on action. In written materials, so if you're actually going to give written materials, again, I think I said this before, but think about materials that are written for your specific population where you're avoiding technical terms, avoiding long sentences, complex ideas, and certainly any medical knowledge. And recommended reading levels to reach most folks is 6th grade or under, and that's what most health education materials are supposed to be given. But it's interesting, as you read written materials, next time you go to the doctor or are in a health setting, pick up some of the educational materials and look through them and see if they follow these guidelines. Are they written specifically for the population they're working with? Is it written in a what level that everybody can understand without technical terms, so that a person can really benefit? So those are some of the mechanics in general, and we will practice in class. But I definitely want you to think about being very systematic when creating educational programs, writing very specific objectives, really thinking about your learners and where they're at in their readiness for learning, but also in their previous knowledge of the material. What experiences do they have in that material before? Have they heard this material, or is it very, very new to them? Thinking about the setting that you're going to use, in the environment that you're going to use, and the materials that you're going to use, and then some of the specific methods, right? How often do you give feedback? How are you going to encourage a person to reflect so that they're using the information appropriately?